So this is Capacitar Practice Self Acupressure. For this practice I've picked out 6 different pressure points to hold, but there's lots actually on the Capacitar website or on some of the booklets. So really accessible, easy to use, either in an office environment, even during the meeting, in the car, between visits or between meetings. It's really helpful. It works on the meridian energy systems within our body, recognising that sometimes some of the pain, the emotions that we're feeling are actually related to kind of blockages in that system. So it helps clear and rebalance, recharge everything. I've picked out ones that are particularly related to some of the issues that nurses and healthcare professionals sometimes experience around about stiff necks and things like that. So before we start, we always get into a comfortable position, you know, our feet on the floor, just maybe roll the shoulders. When acupressure is done alongside deep breathing, I think it's really impactful. So that nice abdominal kind of breathing is ideal. In the Sight Timer I've got a free app that you can use, which is a 5.5 second breathing app. And that alongside acupressure I think can be really helpful. For any of the holds, when we hold the holds, we typically hold for 3 to 5 minutes per hold, but you'll feel yourself probably intuitively when things feel a bit more energised, less blocked. You might feel some pulsation or whatever. I sometimes feel with the neck and the shoulder pain ones, I feel a kind of lightness in my head, just easier to kind of carry my head about. So you'll know yourself. And if it's appropriate to do so, it's good to close your eyes as well while you're doing the deep breathing. So the first movement is called Gates of Consciousness, really good for headaches, neck pain and general kind of irritability. So we start with crossing our hands together, waving them and bringing them up and sitting on the bony protuberance at the back of the head, and then the thumbs come down into the soft area between the bone in the head and the neck muscle. So I'll just turn around so you can see, and we just apply pressure to that area. And then we just take some nice deep breaths. As I say, close your eyes, and if you can, and then we just breathe. Okay. And it might be helpful, because there's the 6 in quite quick succession, even just to pause so you can hold the movements just a wee bit longer. The next one we're going to move on to is called Wind Mansion. Again, really good for headaches and stiff neck. And some people who are stiff in the shoulders find the previous one a bit of a challenge. So this one's a wee bit easier and has a similar kind of benefit to the neck and the headaches. It's also good for stress as well. So we're just going to take one finger this time, and it's almost the area where the skull hinges onto the back of the spine, and there's a kind of indentation, and I'll show you just now. And it's just that, it's almost designed perfectly for a finger to just sit in, and again just apply some pressure, roll the shoulders down, close the eyes if appropriate, and just take a few deep breaths. This is one of the ones that could be done in a meeting, you know, maybe just sitting at a desk. You know, it's not as obvious that you're applying pressure anywhere. So the next movement we're going to do is called the third eye point. Again, a very accessible point that can be used in meetings. You can also lean on the desk doing this, and it can be quite relaxing. It's got the benefit of bringing calm and well-being, and it can reduce feelings of nervousness or anxiety. So you locate the area between the eyebrow and just at the top of the nose, it's a soft kind of area, and apply the one finger pressure to that. And again, we'll just take a few deep breaths and hold this point. So the next movement we're going to do is called the shoulder well. This is located in almost at the highest part on the shoulder before you go on to your neck, and you'll feel if you use the three middle fingers, you'll find a kind of soft area that almost just fits perfectly. And it's good for anxiety, irritability, neck and head pain again. And I think nurses particularly would quite often suffer from tension and discomfort in our necks and our upper shoulders, but also sometimes headaches related to that. So this is a really good one for that. And again, just apply that bit of pressure and just relax. The next one we're going to do is a movement called letting go. And you find there's the crease of your arm. You come in about 4 finger widths in on either side, and you will find a kind of soft, almost tender area, and we apply pressure here. Really good for repressed kind of emotions, anything that you've been kind of like holding in, grief, loss, these types of emotions. The letting go can really help with that. So again, close your eyes and we'll just take some nice deep breaths, 2 or 3. Let it go. So the last one that we're going to do is called Spirit Gate. It's one that works on the hand point. So just where the hand creases onto the wrist, we come a few fingers down, and there's a kind of soft indentation there. Really good for emotional imbalance, fear, anxiety, and sometimes when we're fearful or worried, then we can suffer for a bit from memory loss. So again, quite good if you're in a situation where you can feel a bit overwhelmed. So like going into an interview or a challenging meeting, or actually round about patient care, so end of life care, or anything that's really challenging emotionally, then this is a really good pressure point for that. And of course, easy to do even when you're in a meeting, or if you're sitting talking to someone, then you can be doing this quite discreetly. So we'll just hold the pressure there and take a few breaths. And now we'll just take another few nice deep breaths just at the end. Namaste.